I'm curious, during your time as the Senior Associate Editor and Editorial Fellowship Director for the Journal of General Internal Medicine, was there anything that you particularly did to support the work of building trust and trustworthiness in the peer review process?
Well, I think that you want to build trust and trustworthiness at every stage of everything that you do when you're working with a journal. I mean, part of the way that you encourage people to submit to your journal is by fostering high quality work and trying to support the research that people have done that's thoughtful and contributes meaningfully to the field. So I think the first is we would hold a lot of training workshops on how to be a peer reviewer, on how to be a good journal editor, or a deputy editor. I think that the more you can educate people about how to give feedback constructively and how to be a constructive citizen in the community, I think the better people do. And so, like any other cognitive skill, peer reviewing or being a journal editor has a specific competency set. And teaching people how to be able to do that well is something that I think any person can learn. And it's a very fun process because you get to read early work. So I would encourage everyone to review anytime you can and contribute to the scientific community constructively.
Wonderful. Thank you so much for your thoughts on peer review, especially in context of thinking about trust and transparency.
Yeah, and I think that one thing that we haven't touched on yet that I'm sure you're getting to also is the idea of the preprint.
Exactly, yes. So there has been a lot more attention paid to preprints with the COVID-19 pandemic and trying to get to information as quickly as possible and share information widely. So I'm curious your thoughts on how preprints fit into the ecosystem of peer review and how we can make sure that they can be valuable while not spreading misinformation.
Many years ago, I had a mentor who told me you should never practice medicine from a conference abstract because everything is preliminary. I think the same thing is true with the preprints. The preprints are a nice window into what's coming, but they shouldn't be the way we make decisions as a society, nor should they be the way that we make decisions when it comes to patient care. I think that preprints are very suggestive of where the data might lie, but again, because they haven't gone through this external vetting process where people have helped temper claims that are made, helped figure out if the analytic techniques were appropriate, helped contextualize the work that's being done. We need to be careful about how we use preprints. I love the idea of getting information out early, but I think that we need to be sophisticated in our understanding of what those early findings actually mean.
Definitely, I think education and making sure people are aware of how a preprint falls into the publication life cycle is an excellent point.
Mm-hmm.
So thank you for your time and your thoughts on peer review. We appreciate it.
Thank
And
you, Amanda. It's been my pleasure to join you today.
wonderful. Thank you.